Welcome, everyone. My name is Tim Brigham. I'm the Chief of Staff and Chief of Education at the ACGME, and I represent the Planning Committee for this meeting. And the meeting, as you know, if we could have the first slide up, is ensuring clinician well-being in an age of uncertainty, which we certainly are in, emerging lessons from COVID-19 pandemic, and a systems approach to the future. We had a great day yesterday. Those of you who were lucky enough to have been present saw some very interesting, influential, sobering, and inspirational things. I will take a look at what we're trying to do. Can we have a second slide, please? Our overarching goals for this Action Collaborative were actually articulated by one of the co-chairs of the entire initiative, Dr. Victor Zhao, in a very scintillating way, that the focus on this meeting is on action. We are an action collaborative. The focus on this is to go from theory to action. And so the first part of what our overarching objective is to elevate the urgency of national action. And then to map the efforts needed to coordinate long-term health and well-being of clinicians through COVID-19 and beyond, highlighting this and centering on a systems approach to begin to detoxify the environment. Next page, please. So I'm going to take a step back for a second and just remind those of you who were in the session yesterday, actually what we did. And for those of you who are new, you missed something really good, but you're going to see something really great also. And I'll just give you the launching pad for that. To actually get into action that centers around a systems approach. We had one of the world's experts on applying system approach principles to redesign, Pascal Carillon, give a really informative talk on promoting clinician well-being through redesigning systems. And she highlighted grounding ourselves and using and living our values and the importance of leadership to move those values to action and redesigning work that centers on meaning, autonomy and control, balancing our work and our life, the importance of teamwork and adequate resources to do the job, and the importance of participation of everyone in that redesign. The most powerful way to address the state and situation that we're in was also articulated that this is not a sprint. This is not a marathon. This is not even an ultra marathon. It's like a Ironman version of the triathlon where we've just emerged from the water to get on the bicycle and we're going through. So the only way that we can get through this, because of the duration of what we're in and because of the chronicity of the situation, is not to overemphasize individual resilience, but it's to redesign the system in which people are living and working in. So it was also emphasized that the reason that we can't do that is because fatigue has hit in. And our clinicians have begun to cry out to us in ways that they haven't before, saying, we have to do this together. Hear me, they say, protect me, prepare me, support me, care for me, honor me. We have a duty to do this, to prepare our clinicians to be able to endure this COVID-19 crisis and beyond for the good of our patients. And we had two great examples of redesigning systems to meet the needs of well-being before and during the COVID crisis. We had two people from Christiana Care give a great presentation, Dr. Janice Nevin, the CEO, and Dr. Heather Farley, the CWO, the Clinician Wellbeing Officer. And from Emory, with Jonathan Lewin, CEO, and Sharon Pappas as the Chief Nursing Officer. They talked about the necessity of walking this road and creating change. And the examples gave both hope and inspiration, and an example of how this could be done. The next phase of what we did yesterday was we had a great moderated discussion by my colleague, Dr. Steve Singer from the ACCME, um, to talk about some of the effects that COVID-19 has had on clinicians in their arena of physical and mental well-being, health, and in the economic arena and in the arena of social despair. So Chris Sinski from the AMA talked to us with some data that showed what actually is happening during COVID-19 and in well-being in general in our clinicians, what happens to their mental and physical health. Elisa Arapescada from the AHA gave a very, very sobering look at the economic condition that our institutions are in, even prior to COVID and now highlighted in COVID. And then Dr. Beverly Malone of the National Nurses Society gave a presentation on the horrors of structural racism and the effects that it has on clinicians and the effects that that has on patients. But we didn't leave despairing. We didn't leave depressed. What we left was galvanized and steeled towards action, towards making a difference in people's lives. And saying that COVID-19 is a signal, it's an opportunity that it's time for a reset. It's time to innovate. It's time to remove inequities. It's time to question things, and it's an opportunity that we cannot miss. And we'll leave you with this on that one day. We highlighted 4 areas. One was the importance of leadership. Leadership engaging, leadership leading, leadership participating, leadership listening. We highlighted the importance of what I'll call 3 C's: collaboration, communication, and connection, and how important they are. And then we highlighted the centrality of a word that was brought up in the initial conversation between Dr. Carrion and the Emory and Christiana people, the centrality of a 4-letter word that is often not used in medical education and in medical care is love. And it's love for each other, it's love for our colleagues, it's love for the professions, and it's love for our patients. And that has to be central to what we're doing. And that's the reason that we're doing what we're going to be doing. So today, what we hope to do is build on that platform that we had built yesterday to really springboard you towards action. And today, if we go back one slide, today we're focused on operationalizing targeted system approaches to clinician well-being, where we'll be looking at the national level in terms of legal, regulatory, licensing reforms. We'll be looking at understanding how macro systems affect healthcare, and we'll be developing and giving to you tangible and tactical ways for meeting attendees for you to begin to implement effective systems approaches in your setting for clinician well-being within your own institutions, within your own organization, within your department, within your clinic, etc. And can we have the next slide again, please? So today we're going to have 3 sections. We'll have a shift in our mental model, a systems approach to go towards day 2 yet, I'm sorry. Today we're going to be looking at coordinating national actions for change. And we'll have 3 speakers at the national level looking at the macro systems of what we're doing. We'll take a break. Then we'll have 4 of our colleagues who will be talking about adaptive models of clinician well-being to begin to tell you how to operationalize and put some concrete holdings around what the theories and things that we've talked about. Section 6 will have a mandate for action, and then we'll have closing remarks from the 3 co-chairs of the Action Collaborative, Dr. Naska, Dr. Kirch, and Dr. Zhao. So without much further ado, I'd like to leap into today so that you have the maximum amount of time with the people that have been preparing so diligently to give you the framework and the ability to put into action a systems-based approach to well-being. So can I have the next slide, please?